Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Tacrolimus. Introduction. Patients who have had an organ transplant must take immunosuppressants. Immunosuppressants are medications that do just that. They suppress or weaken the immune system. By doing so, they help your body accept the new organ. Tacrolimus is one type of immunosuppressant. Without it, your immune system would try to attack your organ, leading to organ failure. This program explains how to take tacrolimus. It discusses drug and food interactions, common side effects, how your team will monitor you for problems, and what to do if you miss a dose. Taking tacrolimus. Tacrolimus comes in liquid form as an injection, as a pill that you swallow, or as granules that you mix with liquid. Follow the instructions carefully on the medication label to make sure you are taking it correctly because each form of tacrolimus is different. There are two types of tacrolimus pills, immediate release and long-acting. The immediate release version goes by the generic name tacrolimus or by the brand name Prograf. The long-acting version goes by the brand name Astrograf XL or brand name Envarsus XR. Your transplant team will pick the best type of tacrolimus for you. The liquid form and immediate release capsules, generic tacrolimus or Prograf, can be taken with or without food. Make sure that you take it either with food every time or without food every time. That way, your body absorbs the same amount of medication each time you take it. It should be taken every 12 hours, such as at 8 a.m. and at 8 p.m. Swallow the pill whole. Don't crush, break, open, or chew the pill unless your healthcare provider says otherwise. Swallow the liquid right away. Don't swish it around or let it sit under your tongue unless your healthcare provider says otherwise. Take the long-acting capsules, Astrograf XL, on an empty stomach 1 hour or more before eating or 2 hours or more after eating. Swallow the pill whole. Don't crush, break, open, or chew the pill unless your healthcare provider says otherwise. Take the long-acting tablets Envarsus XR with a beverage each morning at the same time, 1 hour or more before eating or 2 hours or more after eating. Swallow it whole. Don't crush, break, open, or chew the tablet unless your healthcare provider says otherwise. If you are taking the granules, mix them with 1 or 2 tablespoons of water. The water should be room temperature. Mix the granules with a metal spoon, not a plastic one. Drink the mixture right away. Do not mix the granules with liquid and then drink it later. Then pour another 1 or 2 tablespoons of water into the glass you were using. Swish the mixture around in the glass gently and drink it. This will help ensure you are taking the full dose each time. You can drink the mixture with or without food, but do it consistently one way or the other each time. That way, your body absorbs the same amount of medication each time you take it. The granules should not come into contact with your skin, eyes, or airway. If they touch your skin, wash the area with soap and water. If they get into your eyes, rinse your eyes with water. Check with your healthcare provider if you accidentally breathe in the granules. Missing a dose of tacrolimus puts you at risk for organ rejection. It is very important not to miss a dose. Ask your healthcare provider what to do if you miss a dose of tacrolimus. Food and drug interactions. Do not eat grapefruit or drink grapefruit juice while on tacrolimus. This may increase how much medication is in your blood. Changes in tacrolimus levels may put you at risk for organ rejection or side effects. Contact your transplant team before starting or stopping any other medications or supplements. Many supplements have not been tested or proven safe for people taking tacrolimus. Your team may need to adjust the dose of tacrolimus before changing your other medications. Your team may need to monitor your blood levels more often to keep you safe. Vaccines are very important in keeping you healthy, but patients taking immunosuppressant medications should not receive any live vaccines. Ask your healthcare provider or pharmacist if a vaccine is live before getting it. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Monitoring. Your healthcare team will figure out the ideal level of tacrolimus in your blood. This will change based on how long ago you received the transplant, your risk of transplant rejection, and your risk of side effects. If you don't have enough tacrolimus in your blood, you may be at risk of transplant rejection. If you have too much tacrolimus in your blood, you may be at risk of side effects. Your healthcare provider will also monitor your kidney function and electrolyte levels to keep you safe. See your healthcare provider regularly for blood tests. Many factors change the amount of tacrolimus in your blood. For example, the following factors can change your tacrolimus levels: taking your pills with or without food, weight gain or loss, drug interactions, excessive diarrhea, missing a dose of medication or taking the wrong dose. Because so many factors change your tacrolimus levels, lab tests are needed to keep you safe. Tacrolimus levels are tested through a blood draw. The timing of blood draw is very important. The blood work must be done right before your next dose. This is usually before your morning dose of medications. It is important to bring your medications with you to the lab and take them right after blood is drawn. Let's say, for example, that you take tacrolimus twice a day at 8 a.m. and 8 p.m. You will need to have blood drawn around 7:30 a.m. This way you can complete the blood work before taking your next dose at 8 a.m. If you accidentally take your medicine before the blood test, the medication in your system will make it look like your levels are too high. If the team does not know that you took your medicine before the lab was drawn, they might lower your dose too much. This could put you at risk of organ rejection. If you took your medicines before the lab work, always tell your transplant team and lab personnel. The team will probably not make a change to your dose and may ask you to have the lab work done again. L comes before M in the alphabet, so remember to get your lab work, L, before you take your meds, M. Tell your healthcare provider if you missed one or more doses of tacrolimus since your last visit or the week before your scheduled labs. If your healthcare provider doesn't know you missed a dose, they may think the medication isn't working well enough and will increase the dose. Instead, that can put you at a higher risk of dangerous side effects. Communication is important. Remember to tell your healthcare providers and lab personnel if you missed a dose or if you accidentally took your medication right before having lab work done. Keeping your providers informed will reduce your risk of side effects and organ rejection. If the team makes a change to your dose of tacrolimus, they may ask you for another blood sample to make sure the change in dose was the right amount. Side effects. Tacrolimus is a powerful drug. It weakens the body's defense system to protect your transplanted organ from rejection. This can raise your risk of getting an infection. If you have any of the following signs of infection, contact your healthcare provider right away: fever, chills or shivering, diarrhea, nausea or vomiting, runny nose, sore throat, or coughing up green sputum. This section covers side effects that some patients have reported with the use of tacrolimus. Your healthcare provider may prescribe additional medications if you have side effects that bother you or put your health at risk. You may have tremor or shaky hands. Cover hot drinks with lids so you don't spill and burn yourself. Keep open pill bottles away from table edges so you don't accidentally knock them off. Ask for help filling your pill box if needed. You may have a headache. If it feels like the worst headache of your life, seek medical care right away and notify your healthcare provider. You may experience tingling or numbness in your fingers or toes. This is called neuropathy. You may have high potassium levels in the blood or low magnesium levels. Your team will monitor for this when they draw blood. You may have decreased kidney function. Your team will monitor for this when they draw blood. If the color of your urine changes or if you can no longer urinate, notify your healthcare provider. Your blood pressure or blood sugar levels may go up. Your team may ask you to keep a log of your blood pressure and check your blood sugar at home. Women who take tacrolimus during pregnancy may have babies with birth defects. Notify your healthcare provider right away if you think you might be pregnant. Tacrolimus caused problems with fertility in animal studies. If you would like to have children, discuss your plans with your healthcare provider. Other serious but less common side effects of tacrolimus include skin cancer. Wear sunscreen to protect your skin from harm. See your dermatologist or skin doctor regularly. Lymphoma or cancer of the lymph system. Notify your healthcare provider if you notice swollen glands in your groin or armpit area. Seizures. Notify your healthcare provider right away if you have a seizure. You may have other side effects. Tell your healthcare provider if you have side effects that concern you.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Patients who have had an organ transplant must take immunosuppressants. Tacrolimus is one type of immunosuppressant. Without it, your immune system would try to attack your organ, leading to organ failure. Tacrolimus comes in liquid form, as an injection, as a pill that you swallow, or as granules that you mix with liquid. Follow the instructions carefully on the medication label to make sure you are taking it correctly, because each form of tacrolimus is different. If you don't have enough tacrolimus in your blood, you may be at risk of transplant rejection. If you have too much tacrolimus in your blood, you may be at risk of side effects. Your healthcare team will figure out the ideal level of tacrolimus in your blood. Many factors change the amount of tacrolimus in your blood. For example, the following factors can change your tacrolimus levels. Taking your pills with or without food. Weight gain or loss. Drug interactions. Excessive diarrhea. Missing a dose of medication or taking the wrong dose. Tacrolimus levels are tested through a blood draw. The timing of the blood draw is very important. The blood work must be done right before your next dose. L comes before M in the alphabet, so remember to get your lab work L before you take your meds, M. Communication is important. Remember to tell your healthcare providers and lab personnel if you missed a dose or if you accidentally took your medication right before having lab work done. Keeping your providers informed will reduce your risk of side effects and organ rejection. Thank you for using Explain.